Skeletal system in an adult consists of approximately how many bones? 206. Adults have 206 bones while infants have approximately 270 that fuse during growth. The functional unit of compact bone is called osteon. An osteon contains concentric lamellae around the central canal. The type of bone found at the end of long bones is spongy bone. Long bone ends with a spongy bone with red marrow. The largest bone in human body. Femur. The femur is the longest and strongest bone. The smallest bone in the body is located in ear. The stapes of middle ear is the smallest bone. The bone cells responsible for resorption are osteoclasts. Osteoclasts break down bone during remodeling. The bone cells that maintain bone tissue are osteocytes. Osteocytes are mature bone cells inside lacunae. The shaft of a long bone is called diaphysis. Diaphysis is the long cylindrical shaft. The growth plate in long bones is called epiphyseal plate. Epiphyseal plate allows longitudinal growth. Red bone marrow is the site of blood cell formation. Red marrow performs hematopoiesis. Yellow bone marrow mainly stores fat. Yellow marrow stores fat called adipose tissue. The mineral essential for bone hardness is hydroxyapatite. Calcium phosphate provides strength. The membrane covering the outer surface of a bone is peristonium. Peristonium contains nerves, blood vessels, and osteoblasts. Which bone is not a part of axial skeleton? Scapula. Scapula is a part of appendicular skeleton. The appendicular skeleton consists of appendicular skeleton includes limbs plus girdles. Flat bones include sternum. Sternum, ribs, and skull bones are flattened. Bone formation from cartilage is called ossification. Endochondral ossification form most bones. The bone that protects the brain is skull. The vertebrae that allows rotation of the head are axis. Axis has the dents for rotation. The bone in the upper arm is the humerus. The functional unit of a joint is called articulation. A joint is where two bones meet, known as an articulation. It determines movement and stability. The most freely movable joint is ball and socket joint. Ball and socket joints allow movement in all directions, including rotation. The knee joint is a hinge joint. The knee moves mainly in one plane, flexion and extension like a hinge. The joint between the plus and axis pivot. Antoaxial joint is a pivot joint enabling rotation, no movement. Immovable joints of a skull are called sutures. Sutures tightly unite skull bones for protection, allowing no movement. Articular cartilage is made up of hyaline cartilage. Hyaline cartilage covers bone ends to reduce friction in synovial joint. The synovial membrane produces synovial fluid. Synovial fluid lubricates joints and nourishes cartilage. The shoulder joint is stabilized mainly by muscles. The rotator cuff muscles provide primary stability because the socket is shallow. The menisci of the knee are made up of fibrocartilage. Menisci, medial and lateral, are fibrocartilage pads that absorb shock. Which movement decreases angle of joint? Flexion. Flexion bends the joint and reduces the angle. Movement away from the body is abduction. Moving away from midline. The elbow joint is a hinge joint, allows flexion and extension only. Vertebrae are connected by ligaments. Ligaments hold the spine together. The hip joint is more stable than shoulder. Hip has a deep acetabular making it stronger but less flexible than the shoulder. The bursa is a fluid-filled sac. Bursa reduces friction between bone and soft tissue. Synarthrosis joints are immovable. Example skull sutures. The wrist contains mainly clearing joints. Carpal bones slides over another allows clearing movement. The ankle joint is a hinge joint, allows dorsiflexion and plantar flexion. A fracture is a bone break. A fracture means any break in bone continuity. A dislocation refers to bone forced out of alignment. In a dislocation, bone in a joint loses normal contact, causing severe pain, inability to move. The bone that forms the forehead is frontal. Frontal bone forms the forehead and upper part of the eye sockets. The number of cervical vertebrae in human is 7. There are 7 cervical vertebrae regardless of neck length. Which vertebrae is called the atlas? The correct answer is cervical first vertebrae. The atlas supports the skull and allows nodding S motion. Which vertebrae is called the axis? Second cervical vertebrae called axis. This axis has a peg-like structure, enabling the head to rotate. The ribs that attach directly to the sternum called true ribs. True ribs attach to sternum via individual costal cartilage. The bone that does not articulate with any other bone is hyoid. The ribs that attach directly to the sternum called true ribs. True ribs attaches to sternum via individual costal cartilage. The bone that does not articulate with another bone. Hyoid bone is unique. It is suspended by muscles and ligament and supports the tongue. The longest bone of the upper limb is humerus. Humerus is the main bone of the upper arm. The clavicle articulates with the sternum and scapula. The clavicle connects the axial skeletal to the upper limb through the sternum and scapula. The knee nape is the patella. The patella is a sesamoid bone providing protection and leverage during knee movement. The bones of the wrist called carpals. There are 8 carpal bones.